All right, we're going to take you live now to the National Press Theatre, where Justin Trudeau is set to take questions from the media for the first time. Let's listen in.
All right, we'll start with a question from Newman's National Nursing Press.
Hi, Mr. Prime Minister. I'd just like to start off by asking you a couple questions about Margaret Newman's theory, Health as Expanding Consciousness. Could you briefly explain what her theory is and how her work has been impacted by other theorists?
Well, Newman based her theory on the idea that everything that occurs in a person's life is part of the process of expanding consciousness. This means that health is not simply the absence of disease. Instead, people's health is part of their life pattern, and everyone has the opportunity to transform these events and expand their consciousness. Many of her influences stem from Martha Rogers' Science of Unitary Beings. Newman's concepts and assumptions about unity and patterns originate from Rogers' theory. Newman was also influenced from her personal experience with her mother's health struggles.
Sir, could you explain how Newman describes the nurse's role and how does that impact the nurse-patient therapeutic relationship?
Yes, I'll start by showing this diagram Newman created. When the person is experiencing disruption of their predictable and organized state, Newman says that nurses and patients come together to form a relationship to help each other with the process of expanding consciousness. Nurses help to facilitate their patterns of recognition by forming this relationship at critical points in their life and by caring for the human health experience. This is a process that occurs over time and involves coming together and moving apart through periods of transformation.
Now, Mr. Prime Minister, your party has heavily criticized some parts of this theory. Could you explain what these critiques are and how they impact the way this theory is used?
Newman designed it to be a grand theory, but it does not account for people with a deterioration or limitation of consciousness, like people with dementia, Alzheimer's, or Parkinson's. This means Newman's theory may not be applicable to those who cannot express their patterns into words. And since this theory is considered a grand theory, it should be applicable to all areas of nursing. Another critique that should be pointed out is that it is often difficult for Western countries to embrace this type of nursing theory because it lacks an empiric dimension. Research has found that some nurses are reluctant to accept this view because many are focused on the problem-solving care aspect of nursing. Many of the concepts can also be difficult to grasp and understand because it is so abstract. It requires an understanding of health and disease as a unity rather than separated into its parts, so it does not account for people who may want to separate their identity from their illness.
Thank you, Mr. Trudeau.
All right, moving on to Comfort Press Association.
Hi, Mr. Prime Minister. I was wondering, could you please tell me a bit more about Catherine Kolkoba's comfort theory?
Kolkoba's comfort theory is a middle-range theory that helps guide practice, education, and research. She identifies 3 forms of comfort, which include relief, ease, and transcendence, and 4 different contexts: physical, sociocultural, psychospiritual, and environmental. These 3 comforts and 4 contexts create a taxonomic table that help guide nurses to holistically assess and identify a client's comfort needs, and this ultimately helps nurses to intervene appropriately.
Would you say the comfort theory is broad enough to apply to practice in different settings?
Well, she first created the main concepts of her theory while working on an Alzheimer's unit, where she identified the need of comfort measures for those with disabilities. Because the theory focuses on nursing as a holistic care approach, the comfort theory can be applied to a variety of settings in healthcare. Some research was done on women on a postpartum unit, and results found that using a comfort scale and the according nursing interventions showed less pain and discomfort than those who did not receive this type of assessment. But it's not just postpartum units. The comfort theory can also be applied to other healthcare settings like perioperative and hospice and palliative care settings.
One last question for you. What would you say makes the comfort theory unique compared to other nursing theories, such as health as expanding consciousness and the environmental theory?
Applying the comfort theory to practice can lead to positive outcomes for the patients, care providers, and healthcare institutions. As demonstrated by Kolkoba's conceptual framework, it explains that enhanced patient comfort could lead to positive health-seeking behaviors. And this can ultimately help the institution identify the nursing interventions that can best increase the patient's comfort. But there are some limitations to the theory. There can be a lack of understanding about the definition of comfort and what specific nursing interventions entail to improve the patient's overall comfort. And these interventions may result in an imbalance of appropriate nursing interventions being applied to these healthcare settings.
All right, and next up we have the Environmental Nursing Press.
Mr. Trudeau, who is Florence Nightingale and what are the main components of her environment theory?
Florence Nightingale was a nurse who had a big impact on improving sanitary conditions in every hospital she worked at. Her efforts were appreciated by soldiers during the Crimean War in 1853. She later became recognized as a founder of modern nursing and revolutionized hospital practices in her time period. Nightingale believed that the environment could be altered to improve conditions so that the natural laws would allow healing to occur. She included 10 major concepts to consider when providing a healthy environment to allow healing. These concepts are ventilation and warming, light and noise, cleanliness of the area, health of houses, bed and bedding, personal cleanliness, variety, offering hope and advice, food, and observation.
How can the environmental theory be used today if it was developed so long ago?
This theory has a lot of relevance with the ongoing pandemic. Nurses are working hard to ensure the hospital environment is one that prevents the spread of the virus by maintaining cleanliness with hand sanitizer, the use of PPE, and other relevant sanitizing methods. Patients have clean bedding and limited access to components outside their room so that they can recover with less negative environmental stimuli, while nurses continue to offer support and hope to all their patients. Nightingale's theory also continues to put an emphasis on nurses using their own intuition to provide patient care and modifications to the environment.
For our final question, are there any parts of this theory that aren't followed in today's healthcare practice?
Well, some components of the environment theory have been overruled by our current health practices and standards for illness and disease. To use the ongoing pandemic as an example, when people are infected with COVID-19, they are required to quarantine in their household, and when in hospital, patients cannot leave their rooms. And this is in order to prevent the spread of the virus. These health practices don't align with the concept of variety in Nightingale's theory, which says that patients need a change in their surroundings and stimuli to aid their recovery. This implies that confined to the same room with the same surroundings, they are less likely to improve their current health condition. It is examples like this that show that not all components and concepts are relevant today, but many underlying principles of Nightingale's theory are used in nurses' everyday practice.
Thank you for all the great questions. We'll be right back live after this commercial break.